Sudan, and this is one of very important topic, as we know that radiology now is used as a very important tool during the medical application. So today, inshallah, we talk about what's the challenges that we face during the training, what's will be the plan or the proposed plan for after the war finished. And now, as we know, that most of the infrastructure are damaged, so we need a new techniques to train those technologists to be aware of or to practice all the clinical application. Today, inshallah, I will talk about training, radiology training in hospital, and how those simulation techniques can help a lot in these techniques. And also, by end of this, we discuss some examples of the simulation-based training which improves the clinical applications. And this is one of the famous 4 techniques that used 10 years ago in most of the university in Gulf, in Saudi Arabia, for example, in UAE. And this is one of very famous techniques and very successful. We start with the introduction. As we know that Sudan now is in the war crisis, and this war crisis damaged most of the infrastructure in Khartoum. Most of the surface are now damaged, water, everything. And besides that, some cholera outbreak. And if we need to, we talk about the health crisis on this conflict. This is the health care services are suffer a lot from this war. Most of the services are damaged. Public hospital, private hospital, universities, all those services are now breakdown in most of the part. So if we need to reconstruct back the Sudan again, so we need million or billions of dollars. This is one of the estimated studies they talk about. For example, if we need to reconstruct or repair the construction that happened in Khartoum, so we need more than $300 billion and $700 billion for the rest of Sudan. This is a lot of money, so we need to plan carefully about the training, about the surface or the different surface. Digital imaging, as we know, this is one of the very important techniques, and using those digital techniques can help in enhancing the images. Also, they replace the old techniques that was used before, the film-based digital techniques, and also they are very important in modeling and techniques. Nowadays, no any procedure can be done without using radiology. Simulation-based training, this is one of the techniques that adopt even by the international organizations. Example, IEA, Atomic Energy Agency, they use these techniques more than 20 years ago. In Sudan, this is most of the universities that provide the radiology program. Most of those university center in Khartoum, but there are some new programs are starting outside of Khartoum. So this is the most of the university now they provide. And also for radiology, they are different university, different college, they have different programs, and also they provide bachelor programs, postgraduate diploma, and also they have master and PhD in different advanced techniques or modalities of radiology. And this is very important, radiology as part of the healthcare. So we need to train the students very well. There are many challenges, and there are many educational gaps in Sudan. As we return back to the historical contents of the training, this radiology start from the early 18th century. So the classic method was used in training the students, and the students going to the hospital. So this is a classic one. They have leather aprons, and some of those students they exposed to the radiation. So one of those techniques, the simulation, also can help us a lot in protect those students, those juniors, for exposing to the high doses of radiations. And also, as we know, what's come from the war, there are some challenges. Even before our start in radiology, there are many challenges regarding the infrastructure, equipment. There are lack of equipment in most of the hospital outside the Khartoum, and also there are limited access to the simulation laboratory. They not used before the war, and also the cooperations between the clinical and clinical training centers is not fully applied. So now what's going on in radiology, most of the world, they use the advanced educational simulation techniques, and those innovations, as I mentioned before, in 10 or 15 years ago, they start using these techniques. One of those famous techniques, this is the simulation-based learning techniques. This is very useful techniques. Those techniques has many advantages, many benefits, and they are easy, so you can use it and implement it safely for the students. All the students, they can use it safely, repeatedly, and also it's not, even radiology, there is not any exposure for the patients or the people, especially in the sophistication techniques, so we can explain to the trainee different techniques. For example, ultrasound is one of the famous simulation techniques, or even for radiology, there are many simulation techniques they use for different imaging techniques. This is enhance the education corporations. Those simulations, they are two types. One of those called offline simulation techniques. This is mean you have to have a hardware inside the institution, and the other one, you can even use the simulation online. So this means that some university from Sudan, they can cooperate with the other institute outside the Sudan, so they can use these techniques and they get benefit from this. This simulations is very important. As I mentioned, it's very important for techniques. Now, most of the radiology, college radiology program, globally, they use what known as the simulation-based education. This is one of very useful techniques. You can use control-free techniques, improvement, and also you can focus on the clinical decision, even the practice. So we can apply or train those radiologists to the irrelative techniques or real techniques safely without exposure those patients to the more time. Also, curriculum design and training is very important. If we need to apply those techniques in Sudan, so we need to cooperation. We need to train those trainees about the VR, the virtual techniques, and also this can help us a lot in enhancement the technical capabilities of the staff, and also it's emphasize the interactive techniques or engagement between the practical and training. Those implemented is, as I mentioned before, this is start many years ago on the radiology. There are 5 simple steps to implement these models, starting from the structuring those framework. Then after that, we plan, we put create implementation plans or stakeholder analysis. We get feedback from the students then, and we use as an improvement plan for new techniques. Also, instructors are training can use or can create scenarios, configurations for real conditions, and this is very helpful. As we know, sometimes we found that some social barriers, even the training for specialists, some cases in females, so with the male students or male trainee and versa. So this is one of the techniques. So we can use those scenarios, different scenarios, and also the instructor can simulate or create an unusual conditions, and this is increase the experience of the students. Students, they can also engage through what known as the case type treatment education, and this is very important. So we can use active student engagement, discussions, and also we can create or integrated record tutorials, peer lab support, training, and also even some cases we can generate. So the students, they can get benefit from this without providing hardware Also, it's very important for practical result. Many universities, during my study, I look at different universities globally, and we found that there are many applications they use for this 3D teaching environment for radiological technologists, and also they use it for successful models, and also they use it as metric. And this is very important. Here in Saudi Arabia, I work in university in Saudi Arabia. We start 8 years ago. We bring what known as a virtual simulation for radiation therapy. As you know that radiation therapy, most of those students or trainees, they work with the patient, cancer patients, and sometimes this is not available to get training with those cancer patients. So virtual training now available more than 8 years, and now we graduate some students, and those students, they get experience, and some of them are employed now in some hospitals. They get good opportunities to get experience. I think this is can be available for Sudan. As I mentioned, that simulation is not necessary to be offline in Sudan, so we can make a collaboration with some international bodies or institutional, and so we can get benefit from this at level of national, and also so we can get a global partnerships. So from this partnership, we can those can contribute through the Sudanese universities. Also, efforts can be very important for national standard and protocols, and also this is very important for further training. Practical training or resources allocated. This is very important challenges. Also, we need to improve this to apply those simulations. Any simulations, we don't ignore the ethical considerations. This is very important for training in radiology. We have to share the values, the behaviors, the different those values, and we need to integrate them with the educational, the ethics, and also to emphasize the human rights. And those simulations can help us a lot because we don't deal with the patient, so we don't have those ethical indignity and some issues regarding to the patient, and this is very important. And also, so through this, we can taught the student or training some techniques, government and policies. This is very essential also for simulation. Before we start those type of training in Sudan, so we need to make clear policies, clear guidelines. So governments also some regulations that can help a lot in this type of the training, national strategies, from laws, also our permissions of fund. This is very essential. Definitely, we will face some challenges regarding the cost, regarding to the accessibility. But as I mentioned, that it's not necessary to have it your own institution, so you can access through the internet, through the VR from our side. So this is one of the techniques, integrations with the curriculum. This is also, as we know, one of problems that we face with when we apply new techniques, the resistance. But through the training for different trainees, so we can overcome this problem. As a conclusion for my talk, there are many benefits so we can get from reconstructing a new training for Sudan. So we need to use simulation-based techniques. This is the best solution because now we don't have infrastructure. So we don't have that much of money to reconstruct again back our institutional back as they before the war. So we use this. This is a useful techniques. It's very important. So we need to investigate about this and also use these techniques. Role of the simulations in training and new generations. This is very essential. So we can use these techniques to train our students, our trainee in new techniques and apply them. Thank you for your listening. This is the reference for my talk.
Thank you. Thanks, Professor Yousif. Abdallah, you touched on a really important message in terms of using new development and technologies to address training challenges. So thank you very much. I have a question. What is the cost of buying these simulations? Are we talking about something very costly? Or so if you have a simulation lab and you've designed some of them, is it beyond the Sudan capabilities?
Yes, it's available now. One of those techniques using VR. VR now one of those techniques. It costs not more than $300 for one station. So we can generate stations by 10 or 20 generations, and those generations they use software. Those software they don't need that infrastructure, and also we can use the corporations. During COVID, I will mention you some example. During COVID in New York University, they have these simulations in lab, and some of those students outside New York, they use those techniques because you can access to these facilities through the internet, so you don't need to be in the institution. And this is, I think, for coming 5 years, this will be useful and help us a lot in training.